Hello, Mrs. C. How are you today? Good. My name is Latricia Frazier, occupational therapist. If it is okay with you, I would like to go over your medical information, what we're going to do today, and why you're here. Last week, you were hospitalized because you were, having increased symptoms of seeing black patches all over your skin, as well as your face and your arms, and feeling like insects were crawling all over you. So you were therefore admitted to the hospital. You were admitted to the dermatologist ward, where they did further skin evaluations. They also did, in your skin examination, your results are here, came back negative for any skin abnormalities, as well as any skin diseases, any possible skin diseases were also ruled out. So at this time, your doctor has ordered that you continue with the medications, actually that you had stopped taking over, it says here, 2 months ago. Okay, you were prescribed 2 antipsychotics for your diagnosis of delusional disorder, which were done 8 months ago. You were diagnosed 8 months ago. Okay. So it also states here the reason why that you stated to your doctor the reason why you stopped taking your medications because there were too many of them. You were taking 5 medications, so you were forgetting to take your medications. Then you also stated here that you were feeling better, so you thought that you could go ahead and you stopped taking your medication because you were feeling better. Yes. Okay. So taking too many pills, and because you were feeling better, you decided that it was okay to stop taking them. So, okay, so your doctor is thinking that, because you stopped taking your medication, it led to you getting admitted back into the hospital. So at this time, he feels it's very important that, we get you back on track with, taking your medications daily and consistently so that, you can avoid getting, being hospitalized and having any of these symptoms. And, you'll be able to carry on with your life, okay? Okay, so we both agreed that the medications that you were taking a few months ago were effective. They were making you feel better, and that we can go ahead and look at a plan to get you back on that set routine of taking those medications again every day. Now, what I would like to do is I would like to go over with you a daily checklist that I'm going to provide for you. And it includes that you take your medications scheduled every day with this set plan, with this checklist that I provided for you. You were taking 5 pills, so what I was able to do was talk to your doctor about, reviewing your medications, and he was able to get your medications down to where you would only have to take 2 a day, so 1 in the morning and 1 in the evening. So what I have here is a self-grooming checklist. This will be done twice a day for you, and it only involves 4 steps. Okay, so since we're able to get your pills down to 2 a day, this checklist is going to incorporate where you take 1 of your pills in the morning and 1 of your pills in the evening. And I will provide you with extra copies of these. I would suggest that you especially put them in your bathroom. Put 1 in your bathroom, 1 in your bedroom. You can keep it in your kitchen as a reminder that this is something that you need to do consistently every day, your set routine. So what this involves is checklist for in the morning, checklist in the evening. What you will do in the morning, wash your hands and face with soap. This is provided by your dermatologist for you to use. You will dry your hands and face with a clean towel. Then you will apply lotion to your hands and face. And then when you're done with those 3 steps, you're going to take your first pill. This is going to be the Seroquel pill. It's 300 milligrams. And you will take note that you need to take this with a full glass of water. Okay. Once you've done that, you're going to check all these off, and you're done that 4 in the morning. In the evening, you're going to come and you're going to do the same exact thing. You're going to wash your hands and face with soap. You're going to dry hands and face with a clean towel. You're going to apply lotion to hands and face, and then you're going to take your second pill, which is going to be your Thorazine pill in the evening, and this is 200 milligrams. Okay, so once you're done with that, you're going to check these boxes off, okay? And all these checklists will have dates on it so that you can keep track. Once you're done with this, every sessions that you come back to, you're going to bring this with you, and we're going to keep track of it and make sure that it's working out for you, okay? And like I said, until this becomes a set habit, a set routine that you do every day. Okay, so some things, I want to go over your side effects of some of these medications that, you know, I will also provide the handout I have here for those for you to have with you. Here's the handout that I will give you. And the first one we're going to talk about is going to be for your first pill in the morning. The first pill in the morning is going to be your Quatapine, the Seroquel. So side effects you may have with your Seroquel that you're taking in the morning is dizziness, weakness, you may have increase in appetite, weight gain, you may have some nausea, vomiting, dry mouth, constipation. So you may want to, you know, keep some water with you throughout the day for the dry mouth. If you're feeling any of these symptoms, they get increased, you know, call your doctor and talk to your doctor about these symptoms that you're having. The one that you're going to be taking at night is the Thorazine. And side effects for this pill may include swelling in the face or the hands, tingling in your mouth or your throat. You may experience some chest tightness, some dizziness, some jerky muscle movements. So with both of these medications, you want to take them both whole. You do not want to crush, chew these tablets at all. Okay, so you want to take both of these medications at whole. For both of these medications, if you do miss a dose, take it as soon as you remember. If it is close to this, for the next one, say, you know, you went to bed at night, you forgot your night dose, and you wake up in the morning, just take your regularly scheduled morning dose, and on your self-grooming checklist, you would leave that box empty so that, you know, we can track that you did not take that medication. So those are the side effects for those medications. Then you have some precautions that you also want to be aware of that I want to go over with you. And precautions, especially for the Seroquel that you're going to be taking, that you want to be aware of, is changing blood pressure, heart rhythm, and body temperature. These can be very, you know, some life-threatening issues here. So you immediately want to notify your doctor if you feel any of these symptoms. So I'm going to give you these handouts, your side effects and your precautions, and just remember, if you feel any of those symptoms, you call your doctor immediately and let them know. Also, what I'm going to do is I'm going to provide you with 2 clock alarms to take home and place. You can take one at home and keep one at home in, you know, whatever room you prefer, your bedroom. And if you want to take one at work, that's fine. If you want to also get some more clocks and put them around the house, that would be fine with me too. But these 2 clocks that I'm going to provide you with are going to be set for 8:30 in the morning and at 6:30 in the p.m. So they're going to alert you that, you know, you need to come to your self-grooming checklist again, and you need to do these steps. Okay? So you're going to have your checklist to come to and perform, and you're going to have your clocks that's going to alert you to perform your checklist. Okay? in case you go out of town, what I'm going to do is you're still going to have your checklists to take with you. Leave some in your car. That way, you know, you have these with you. I have a watch here that I'm going to provide you with. It's set also at 8:30 and at 6:30 that alerts you to go to your checklist and perform your steps so that you will take your medications in the morning and your medication at night. And so that, you know, we are getting that compliance with your medication. You're taking them on a daily basis, and we don't have to have a reoccurrence of, you know, you're going back into the hospital. I want to make sure we have everything. Do you have any questions for me so far? Okay, I think we got everything then. If you have any questions for me, we're going to go into the act of doing your first self-care grooming checklist right here. Let's start. So here's the sink. I'm going to have you go up here. You can wash your hands and face. Good. Here's the soap. Good. Here is a dry towel. Okay. Now here's the lotion. And there's your medication, so you open that. And you can take your first pill, which is going to be your Celecoe. And here's a cup of water. Alright, there's no more questions. If you have any questions, you can reach me, you can contact me, you can contact your physician if you have any questions. And I will see you next week, and we will review your checklist. Please bring these forms back with you so that we can keep track and go over any concerns or questions you may have. Okay? Thank you. I will see you next week.